Thank you very much for the kind introduction and the kind invitation to this beautiful city and this important meeting. Today, I will talk about some innovations and the best practice in the field of gastroenterology. And this is my outline today. I will talk about esophageal disease followed by stomach and then colorectal diseases. Regarding esophageal squamous cell carcinoma, a clinical study have shown the efficacy of salivary microRNA for early detection and to predict the prognosis of esophageal cancer. And in this study, they developed in the development phase. They identified 6 microRNA that were associated with the development of esophageal cancer. And then they used 3 cohorts to validate its efficacy in the prediction of prognosis. And in the training set and in the internal validation set, and they also have in external validation cohort. And in the case control study, they found that the microRNA levels were differentially expressed in patients with esophageal cancer and in control groups. And the combinations of this microRNA can improve the accuracy for early detection of esophageal squamous cell carcinoma. And then they further divided the esophageal cancer patients into 2 groups according to the expression of microRNA, and they divided them into the high risk and the low risk group. And they confirmed that the mortality, the overall survival and the progression-free survival were better in patients with categorized as low risk signature group. And then regarding the gastroesophageal reflux disease, there was an excellent review article published in New England Journal of Medicine. And I think if you are interested in this review, you can read this article later. I'll just give a brief summary. And the indication for upper endoscopy usually refers to those with heartburn symptoms as well as they have alarm symptoms. And currently, lifestyle modification is still the key part of medical management, but PPI are the most effective medications. And regarding the timing for stopping PPI, their suggestion is that if their symptoms are responsive to PPI for 8 weeks, and their symptoms are not complicated, then we can try to stop PPI, and that's the suggestion. And as regarding the dosage of PPI for those requiring long-term PPI, their suggestion is that we should be carefully assessed the indication for long-term PPI use to control their symptoms. And this is another review article published in Nature Review Disease Primer, and this algorithm is very clear and very helpful. And I will not go into details, and you can read this article to look at the algorithm for management of reflux esophagitis. And then I will go on to stomach disease. And this is a very important clinical study to confirm the interaction of H. pylori infection and host genetic factor in the development of gastric cancer. This study was the first, including a case control study, a very large sample size, about 10,000 patients with gastric cancer, and nearly 40,000 patient control groups. And they use the target sequencing of 27 cancer predisposition genes, and then they try to identify the pathogenic germline variants that are associated with development of gastric cancer. And in this study, they identify nine pathogenic variations in 9 genes that were associated with increased risk of gastric cancer. And they also classified to try to assess the age of onset of gastric cancer in those who harbor these pathogenic variants. And you can see that CDH1 mutations were associated with young onset gastric cancer. And they also try to assess whether younger patients with gastric cancer have a more pathological variants. And they confirmed that for those with younger onset of gastric cancer, they have more germline pathogenic variants of the 9 genes. And they also validate their finding in another in an independent cohort. And in that study, they also checked H. pylori by serology test, and they try to calculate the cumulative incidence rate of gastric cancer in patients with a different status of H. pylori infection and pathogenic variants. And they found that in those who carries pathogenic variants and also have H. pylori infection have had the highest risk of gastric cancer. And interestingly, for those who carries pathological variants but they do not have H. pylori infection, then their risk of gastric cancer was not significantly increased compared to those without the pathogenic variants. And but notably that even if they do not have the variant the pathogenic variants, but if they have H. pylori infection, then their risk of gastric cancer was still higher than non-infected subjects. And then I will go on to the molecular subtyping of gastric cancer. And actually, this molecular subtypes of gastric cancer has been published and proposed in 2014. But after 10 years of work, we have collected more evidence to suggest the individual or the personalized treatment according to the TCGA molecular subtypes. And the characters of these four molecular subtype of gastric cancer are shown here. We can see that EBV virus, the group, account for about 10% of gastric cancer, and it is associated with immune cell signaling pathway, the alteration in this pathway, and the recommended treatment is immune-based approach regimens. And for the other molecular subtypes, they also have some proposed treatment regimen. And then they further proposed a strategy to treat a patient with gastric cancer according to the molecular subtypes or other molecular alterations. And this is still a proposal, and more evidence from clinical trial are still needed to validate whether such a proposed algorithm can be applied in routine clinical practice. And then I will go on to H. pylori infection. This is a landmark study from UK, and this study is the first large-scale randomized control trial to assess the efficacy of H. pylori eradication in the reduction of peptic ulcer bleeding in older patients receiving aspirin in the primary care setting. And in this randomized control trial, patients taking aspirin were randomized into two groups. One group receiving eradication therapy and the other group receiving placebo. And they found that in the first 2.5 years, the instance of peptic ulcer bleeding was significantly reduced in patients receiving H. pylori eradication. However, 7 years after the therapy, they did not observe significant differences between the two groups. Therefore, their suggestion is that H. pylori eradication protest against aspirin-associated peptic ulcer bleeding, but this might not be sustained in the long run. And then regarding the antibiotic resistance of H. pylori in Asia-Pacific region, we conducted a systematic review and meta-analysis, and in collaboration with Professor Yamaoka. And we found that the prevalence of levofloxacin resistance and clarithromycin resistance and metronidazole resistance have increased substantially during the last 3 decades. And currently, the primary resistance of levofloxacin and clarithromycin are higher than 30% in Asia-Pacific region. So maybe future actions are needed to prevent further increase of antibiotic resistance, and deciding the optimal treatment for H. pylori infection in the first line and the second line are also needed. But fortunately, we can see that the prevalence of amoxicillin and the tetracycline resistance remain lower than 5% in this region. And regarding the personalized treatment for H. pylori infection, culture-based susceptibility testing is the standard in the past years, and but there are some disadvantage of traditional culture because it takes 1 to 2 weeks to get result, and not so many laboratory are available for susceptibility testing for H. pylori infection. And in recent year, molecular detection of levofloxacin and clarithromycin resistance have been shown to correlate very well with susceptibility testing. Therefore, we conducted 2 randomized control trials to compare the efficacy of a molecular testing guided therapy versus susceptibility testing guided therapy in the first line and in third line treatment. And our result showed that molecular testing guided therapy is not inferior to traditional susceptibility testing guided therapy in the treatment for H. pylori infection. And regarding the second line treatment, levofloxacin-based therapy and bismuth quadrupole therapy are currently the recommended regimens according to international consensus reports. But as I have mentioned in the previous slide, that the prevalence of levofloxacin resistance is increasing dramatically. Therefore, we conducted a randomized control trial to compare the efficacy of levofloxacin-based sequential therapy versus bismuth quadrupole therapy in the second line treatment for H. pylori infection. And our result showed that levofloxacin-based sequential therapy was not inferior to bismuth quadrupole therapy, and the resistance rate of levofloxacin was above 30% in this trial. And therefore, both regimens can be recommended in the second line treatment for H. pylori infection. And then we further conducted studies to assess the changes of gut microbiota and the antibiotic resistance after the treatment for H. pylori infection. And here we can see that immediately after eradication therapy, the alpha diversity was significantly reduced in patients receiving either levofloxacin-based therapy or bismuth quadrupole therapy. However, we can see that the alteration in the alpha and the beta diversity can be restored gradually 1 year after eradication therapy. This supports the safety of H. pylori eradication on gut microbiota in the long term. And then, because our previous thoughts are that the use of antibiotics will induce antibiotic resistance in individual patients, so it's also a concern for the widespread use of eradication therapy to prevent gastric cancer. However, whether the short-term increase of antibiotic resistance can be restored remains largely unknown. Therefore, we assessed the susceptibility testing of E. coli in the stool in patients receiving the second-line treatment. And we found that the resistance to quinolone was significantly increased shortly after levofloxacin-based therapy, but not in those receiving bismuth quadrupole therapy. However, the transient increase of levofloxacin resistance could be restored 8 weeks after eradication therapy. And then we further look at the antibiotic resistance before and after eradication therapy. And our data also confirmed that the increase of antibiotic resistance after eradication therapy is transient and can be restored to basal state 2 months after eradication therapy. And this is an excellent review, and it covers a wide range from epidemiology, the pathogenesis, and the clinical aspects, and the future prevention aspects of H. pylori infection. And I will not go into details, but you can you can read this article if you are interested in this topic. And then I will go on to colorectal diseases. And this is a very important study published this year because in our previous clinical practice, ileocecal recession are usually reserved for patients with complicated Crohn's disease. But a cohort study from Netherlands, they try to assess whether early ileocecal recession is beneficial for patients with Crohn's disease. And they in the database, they identified patients receiving early ileocecal recession versus those receiving anti-TNF alpha treatment. And their result showed that 33% reduction in long-term adverse outcome in patients receiving early ileocecal resection. And the finding from this study have maybe have some implication in the management of Crohn's disease. Maybe we can start to think that maybe the ileocecal recession can be performed in the early stage rather than reserved as the last method to treat complicated Crohn's disease. But further well-designed randomized control trial will still be needed to confirm whether such intervention is beneficial in the long term. And then, as we know, that colorectal cancer screening is an important issue. And recently, a cohort study have confirmed that the patients who received the invitation for colorectal cancer screening by colonoscopy were associated with a reduced risk on the instance of colorectal cancer 10 years after the intervention. And the result from this trial provided evidence on colorectal cancer screening by colonoscopy. And then another landmark study is regarding the microbiome-based therapy for recurrent Clostridium difficile infection. And the SER-109 is composed of live purified Firmicutes bacterial spores. And a well-designed randomized control trial have assessed its efficacy for patients with refractory or recurrent C. diff infection for at least 3 times. And this agent was administered for 8 weeks in patients who experienced at least 3 episodes of C. diff infection. And their primary outcome is to assess the recurrence after the SER-109 versus placebo after treatment. And their finding is that the use of this agent can significantly reduce the recurrent Clostridium infection at the end of treatment. And regarding the efficacy, they found that the recurrence rate were usually higher in older people, but this agent was effective in both younger patients and in older patients. And in the subgroup analysis, they also confirmed that this agent is effective in patients receiving either vancomycin or other antibiotics in their previous treatment for Clostridium infection. And they also confirmed that the use of this oral microbiome therapy can have engraftment of this probiotics, this agent in our gut. And regarding the secondary bile acid, there were no significant difference between treatment group and the placebo groups. And ladies and gentlemen, then I would like to conclude that salivary extracellular microRNA are potential biomarkers for early detection and prognostication of esophageal cancer. H. pylori infection modified the risk of gastric cancer associated with germ-9 pathogenic variants in homologous recombination genes. And the transient increase in antibiotic resistance and the perturbation of fecal gut microbiota diversity were largely restored to pre-treatment states 2 months to 1 year after H. pylori eradication. And ileocecal recession may have a role as first-line therapy in Crohn's disease patients and challenge current paradigm of reserving surgery for complicated Crohn's disease refractory or intolerance to medications. And the oral administration of SER-109 was superior to placebo in reducing the risk of recurrent Clostridium infection. And thank you very much for your kind attention.